So the federal government has mandates that really incentivize the adoption of EHRs. And then there are going to be penalties if they don't comply. Can you explain a little more about that?
Yeah, Jackie, you're 100% correct. You know, the government actually was very smart in how to implement this. They decided they're going to take the carrot approach and then the stick approach. The carrot approach was they took a large sum of money and they set aside, this is money guaranteed to hospitals and doctors' offices. It's $20 billion. Wow. Committed to giving to hospitals and doctors' offices if they start using computer technology to help better patient care. That process is over a 4-year process. Starting January 1st, 2011, this program begins, which means hospitals or doctors' offices that are using what they call certified software, then these hospitals will be eligible for this money. To give you an example, some hospitals, depending on the size, are going to get $2 million over 4 years. Some hospitals are going to get $9 to $10 million over a 4-year period. Doctors' offices can get $44,000 over a 4-year period, and special doctors' offices, ones that take care of a lot of Medicaid patients, can get $63,000 over 4 years. But here's what's important, that remember, it's the carrot, and every year, starting January 1st, 2011, every year after that, they lose approximately 25% of that carrot, of the incentive money. As we just talked about, for hospitals, it's millions of dollars. For doctors' offices, you know, it's over $44,000. So what happens that in 4 years now, that not only do they start losing the money, but at the end of the 4th year, the government said, wait a minute, you're not on computers. We think the quality of care you're providing is less. So we're going to start paying you less for the surgeries you do at that hospital. We're going to start paying you less for the tests that you do at that hospital. So the government really has created a business model that rewards hospitals that are committed to improving the quality of care through technology, and it's created basically the stick and said to hospitals, you know what, even if you don't agree, you need to install computer systems that your doctors and nurses want. It's the only way to provide quality care, fast care, and customer service care. And so one of the things that has been important to us is to create a trust fund, and basically an investment fund that hospitals can access in order to be able to purchase these software systems and the cost of implementation as well as using hardware.
That's exactly right. The $100 million fund bridges the gap between hospitals that want to take advantage of the EHR stimulus incentives but are not financially capable of doing so on their own. So we're able to step in and at no upfront cost to them, rapidly deploy our ONC certified EHR product, get 100% of their users up and running at an industry-leading timeline, and Empower is compensated after the fact once we've proven our role in the process and they start receiving their EHR stimulus incentives. At that point, we're compensated. They have the product for the life, and they continue down a path of moving from paper to computer-based documentation in record time and before these deadlines go into effect.
So you're adding an incentive on top of the incentive, basically.
That's our goal.
Part of the problem with a lot of these electronic medical systems is that they were created in an office somewhere, wherever, Silicon Valley, Research Triangle Park, and it just doesn't work on the floors in a mid-sized community hospital where the workflow just isn't conducive to what they've decided was an important feature. One of the things that I like best about Empower is it's physician run, it's physician designed, and the workflow makes sense to the average practicing clinician. There are drop-down menus if you need them, but if, for instance, you're giving an antibiotic in a very unusual way or some other drug in a different way, you can free text in pharmacy to dose. You can free text in, please have pharmacy call me. Just as if you're writing an order, that's the way you order in Empower. And from a physician standpoint, it's extremely user-friendly.
Now, Christopher, I mentioned earlier that EHRs are mandated now for providers to qualify for incentive payments. How do you see government mandates overall? Are they beneficial, and why?
I think their potential is very beneficial. It fast tracks a change in healthcare that has been long overdue. Many facilities had interest in adopting EHRs, and they may have tried, but the government is bringing in incentives and eventual penalties to move this entire process along as fast as possible, which will benefit clinicians in using the products if it's the correct product chosen, and then it'll benefit the patients in terms of the efficiency of the care they receive when they're in the hospital units.
And why is the government mandating the adoption of EHRs?
I think they understand the importance of leveraging technology to unify the healthcare system, to be able to gather important data for trending and analysis. And I think they understand that it'll benefit the individual patients in tandem with the general overhauls to the entire system. I think it's long overdue, and the government is taking somewhat visionary action to try to make this happen.
It was the government that identified the fifth most common cause of death, to Americans were medical errors, and they recognize technology can dramatically reduce those deaths.
What role does certification play?
I like a lot of people like to give the government a hard time, but I have to be honest with you. They have done a very good job in what is called certification. What they realize is that a lot of companies out there were selling software that was incomplete, was not comprehensive, and not useful for a doctor, and yet they were selling it to doctors and to hospitals as a functioning electronic health record. What the government said is, you know what, just like in the airline industry and just like in telecommunications, we need a standard. And that's what they did. They set a standard in how software should function for doctors and nurses in hospitals. And they basically went to all the vendors to say, if you want to sell software, you got to meet this standard, which is known as ONC certification. So if a software has passed that certification, then it meets the basic level in order for a doctor or nurse that has the functionality for them to practice medicine. What's great on top of that, then the government said, wait a minute, if you use the certified software, then we're also going to commit $20 billion of healthcare IT incentive money, because now we want the hospitals to buy the certified software. So it's not only important enough that vendors have certified software, but then there had to be an incentive program to get hospitals to buy it. And that's where the exciting part of hopefully this conversation will go, and that is that what the government now has done, and they're committing billions of dollars into getting these certified software programs into hospitals and doctors' offices.
What does Empower offer that you consider unique?
Well, first of all, the fact that it's a physician-owned company that's led by physicians and nurses puts us in a class that's a different breed, because doctors and nurses think and document and communicate a very different way. What you'll see with our system is doctors are using it 100%, 24 hours a day, 7 days a week. No other system can do that except one. And that system, in their defense, they got doctors on the computer system. Doctors hate it, but they're using it. And that's important, because we'd rather them be using it than not using it, because there are the safety issues that we've talked about. The three key differentiated areas are we're ridiculously user-friendly. There's only 6 buttons to learn for the doctor. There's only 6 buttons for the nurse. What that means is there's only 15 minutes of training to learn Empower.
It looks simple. When I looked at it, I understood it.
Right. It doesn't mean that the doctor or nurse is lightning fast in 15 minutes. But what it means is they know how to document a history. They know how to order a medication. They know how to order a test. All these other systems require 8 hours or 3 days of training.
Oh.
The second area that makes us unique is we are comprehensive. Okay, very comprehensive, and not just in the practice of medicine, but we have all the smart logic to assist and guide the doctors and nurses for best practices in medicine on how to manage certain diseases like diabetes and heart failure. In addition to that, we have best practices or management reports, so hospital management teams now can manage their hospitals with real data. And the third part that makes us unique is we are fully integrated in the healthcare community, which means no matter what kind of information is generated, whether it's a biopsy from a breast mass, whether it is a colonoscopy, from a GI study, all of that within seconds of it being completed is immediately available to your personal physician, so they can make decisions in real time and not have to wait the days, weeks, and months that everyone personally experiences.
The actual visual test, the actual screenshot is there.
The actual result, the interpretation, as well as the actual picture of the case of a colonoscopy. You'll see, hopefully, a normal colon versus one with cancer. But yes, and again, the moment that test is done across town, it is immediately available in your doctor's office.
Wow, that is incredible. So why do clients choose Empower? It sounds to me like you've listed many reasons, but why else?
Well, I think that the most fascinating, most humbling to my team and I, remember, it's not just, me. There's a team of physicians and nurses behind us, and a team of IT software programs that are just committed to designing user-friendly, comprehensive systems for doctors. But I think the most rewarding piece of this is for doctors to come to us, and we have a group of hospitals we work with, and they actually came to us and they said, Seth, thank you. I get to leave the hospital 2.5 hours earlier each day. Please understand what a
wow.
hospitalist is. A hospitalist takes care of people in the hospital, which means they take care of the sickest patients in the country. And these hospitalists came to us and they said, we're leaving 2.5 hours early each day. And the reason being, not because Empower allowed them to do it, but the information was real-time, simple, easy access. What allowed them to do is we took away all the inefficiency of paper. They didn't have to look for the nursing note. They didn't have to look for the vital signs or the CAT scan report. So we took away the inefficiency, and when you make them efficient, that 2.5 hours can spend time with their family. That can be spent time learning medicine, working on customer service with family and patients. But the point is that we're not talking about making doctors a little bit more productive. We're talking about dramatically improving their efficiency, making that a win for the patient, the family member, the doctors, and their families.
Sure. What do you hear from clients that gives you the greatest satisfaction?
After practicing emergency medicine, to see the ability to deliver not just quality care, but fast care and customer service, because they're all connected, right? If you deliver quality without speed, it's not customer service oriented, and if you deliver speed without quality, it's not customer service
Absolutely.
oriented. And when you see clients come to us and them tell us how much their patient satisfaction scores have increased,
Oh, wow.
how much the efficiency has increased, how much the revenue has increased, because when you offer better clinical services, more patients come. It's a win-win for everybody. But really to see basically quality of medicine improve, to see pain and suffering relieved, to see people be happy in hospitals. Because you remember, doctors and nurses love practicing medicine. All right, they love it. What they hate is this ridiculous amount of
Paperwork.
that slows them to and brings them to their knees each and every day that they practice.
Wow. So what do you see as the future for Empower?
I think Empower has the new business model. To be honest with you, we are, our goal is the same goal as Apple. We are out there to be the Apple of hospital clinical documentation. We're never going to be the IBM or the Microsoft of hospital computers, but we are out there to be best, and we're also out there to be best as a solution for a hospital that's financially successful, as well as those who are being financially distressed. The best group of hospitals right now for us, because of our new $100 million investment fund that really allows essentially unsecured loans to hospitals to install or get the resources to install these software systems and these computer systems. I see our greatest moment in time is being able to help our poorest and weakest hospitals improve the quality of the care that they deliver to a higher level than the hospitals that are making lots of money.
Wow. Christopher, what about you? What do you see as the future of Empower?
I think Seth stated it perfectly. I think we're very excited that we're able to deliver our certified technology where they can improve patient care. The huge benefit is that we're offering this $100 million fund structure where there is no out-of-pocket expense for the hospitals up front. We're able to deploy the software, get them up and running. Once they start receiving their stimulus incentive dollars, then the fund can be recuperated.
Well, it's so easy to see why we're in such a transformative time in medicine. I mean, when technology can make such a difference in the way patients are cared for, in the lives of the doctors and other care providers, and really in the functioning of the hospital. So thanks to both of you so much for sharing your knowledge.
Great, thank you for listening to our vision. And again, we're very excited for healthcare and technology.
It's been our pleasure. Thank you.